All right, y'all. Thank you all for joining us. My name is Molly DeMarco. If you haven't joined us on one of these webinars before, I am with the SnapEd Toolkit team here at UNC Chapel Hill. I'm joined today by co-hosts from the SnapEd Connection and also ASNA's Race, Health, and Social Equity Committee. This is the fourth of these trainings that we've done related to advancing equity within SnapEd programming, evaluation, and administration. We're super excited to have you here. We can go to the next slide. We always like to start out with honoring native lands with this particular slide. I'm just going to read. We gather for this webinar from different places, but all on the traditional lands of Indigenous peoples and past and present. We honor with gratitude the land itself and the people who have stewarded it throughout the generations. This calls us to commit to continuing to learn how to do better, to be better stewards of the land we inhabit and the practices in which we engage. We'd like to invite participants to share what lands they are on today in the chat. So if you would put in your name, your city and state, and the land you're coming from, that would be wonderful. As I just did. We can go to the next slide. I'm not going to go into all of our guiding principles, but we use these in our slides every time we do these presentations. And I do encourage folks to give them a look and some thought, because we're pretty mindful about what principles we use as we go through this work. We can go to the next slide. We wanted to provide an overview of what we'll be talking about today, and that's me doing the overview. I'm then going to turn it over to Latrice Davenport to give some framing of the issue, how what we're doing today relates to what has gone in the past and about advancing equity. Latrice, I have probably 4 more slides before we get to you, just so you have a heads up. Then we'll have 5 people doing presentations for you about how they've advanced equity and doing needs assessments. Latrice will come back at that point to talk a little bit, give it somewhat of a wrap up and talk about how to use what we learned today in developing our statewide SnapEd plans. Then we'll do a little bit of wrap up and next steps at the end. You can go to the next slide. I do want to provide some housekeeping as usual. If you notice, there is a Q&A feature in this Zoom. It's down at the bottom. We encourage you to ask your questions there. Some of them may be answered at the end live, but we will also be answering them in real time typed out in there. So you should use the Q&A. We also do have the chat feature open because we love to allow people, I'm seeing actually that the chat is disabled, and I was going to say we'd like to allow people to communicate with each other. If we can get that undisabled, we'll try. If not, sorry, y'all, we won't be able to do chat today. Looks like one person was able, or it is now open. We do have live captioning on, everybody. So if you go to live transcript at the bottom and turn it on, you can see that. You did receive a link to these slides, so no need to be taking notes. You have this link unless you want to. We are also recording this webinar. The webinar link will be emailed out to everybody who registered, even if you couldn't participate today. It will also be posted on all of our hosts' websites. And as you know from getting the link, it's already on the Toolkit website. We will also do the Q&A in writing and send them out in email and post them to the SnapEd Toolkit website, so people will always have access to those. And the last thing I wanted to just say is that we do have CEUs for registered dietitians available, and we will process those, so people should contact us about that. We can go to the next slide. Rachel, next slide. Thank you. We all, in addition to our guiding principles, we always want to just note that webinars that we do are not open to discussions that question or challenge the existence of racism, injustice, and inequity. This webinar is also not a place to question the validity of learning about these things, about race, racism, equity, or white supremacy. When you ask your questions or you share in the chat, we ask that you share your learnings and reflections and truths using I statements whenever possible and focusing on your own experiences and understandings, and treating each other with respect and honesty and grace whenever possible. If you have any concerns or questions about these discussion agreements, I'm happy to have you contact me, and my information is there. We can go to the next slide. This is where I turn it over to Latrice Davenport. For those of you who don't know, Latrice is the state SNAP-Ed coordinator from Georgia and the co-chair of ASNA's Race, Health, and Social Equity Committee. Thanks, Latrice.
Thanks, Molly. Next slide, please. So I'd like to start with a summary. This is the third webinar in a series discussing needs assessment. The first really focused on state agency staff and giving us an opportunity to kind of think through where we were, what are some potential ideas to implementing a statewide assessment. Webinar 2 included state agencies, implementing agencies, both state and local. And it really examined the role of, what does it mean for the state agencies to lead this work, and how might we do this work in partnership with a variety of community-based organizations, agencies, community leaders, and to do it in a way that really honors the work that they are likely already doing. And in today's webinar, we'll be kind of going through some examples of what an equity-centered needs assessment could look like. And we hope that we'll be able to provide you some specific recommendations that you can use in your own programming. Next slide, please. So some practices in general, when we speak about equity, we're really kind of thinking through how exactly are we rethinking how decisions are made, whose voices are centered, and making sure that that we're really distributing that, creating more and broader decision-making processes, expanding funding opportunities to marginalized communities. And so some of the ways that equity practices could show up in an assessment could be, really culturally adapting assessments, questions, focus, really taking an asset-based approach. So focusing on and identifying existing assets within communities. And this includes the people, their institutions, their relationships, any physical assets, and really leveraging those to enact change. Creating shared decision-making processes, so really thinking about how to engage community members. How are we going to make sure to honor that wisdom? How is that information used to inform our processes and our programs? And creating accountability structures so that we're building trust. And that includes, where we recruit participants, interpreting data, creating accessible data platforms, reallocating funds to organizations that are led by marginalized people, such as people who live with a disability, Black, Indigenous, and people of color. Funding local and community-based organizations, again, really supporting local solutions and leading and supporting local organizations in understanding how their communities see and are, potentially already addressing concerns. Sharing financial benefits. So, if you've developed a some type of product, workbook, toolkit, guide that your institution is selling and creating a profit from, sharing those profits with community members as a way to honor their expertise. Co-authoring journal articles. Those are some practices that you can incorporate into your work that really center equity. Next slide, please. And now we have a poll. And I believe you should see a poll on your screen. And this poll asks, have you conducted a needs assessment to inform your SNAP Ed plan? So it looks like y'all are already working hard answering that question. So thank you. All right. I'm gonna wait till it slows down a bit. So I'm gonna take a couple of moments. Okay, slow down a bit. So I'm going to end poll and share results. Can you see the results? You can. So it looks like 40% of attendees are new to conducting these assessments. About 45% have been involved with these assessments, and about 16% have led a needs assessment. So a good mix of folks on the call, and we welcome any ideas, any practices that you've incorporated in your programming throughout this presentation. Okay. Next slide. All right, I'd like to introduce, I'm really excited to hear from each of these speakers. Cherie Nemick is a registered dietitian and certified lactation specialist, an Indigenous breastfeeding counselor, and a member of the Red Cliff Band of Lake Superior Chippewa Indians in Wisconsin. For the last 20 years, Cherie has worked with Tribal WIC, SNAP-Ed nutrition education and obesity prevention, and breastfeeding the traditional way through Great Lakes Intertribal Council. And Stephanie Russell is a registered dietitian with more than 12 years of teaching, coordinating, and providing leadership for Oregon State University Extension Services, SNAP-Ed. And Beatrice Botello is currently serving as the Family and Consumer Health SNAP-Ed Program Coordinator at Oregon State University, where she focuses on diet quality, food safety, physical activity, food security, and food resource management. And Mariela Hernandez is a community health worker and community advocate. She currently works at the Orange County, my apologies, Health Department, and is a family navigator with Family Success Alliance in North Carolina. And our last speaker is Mariah Brown-Pound. She's a SNAP-Ed Latinx Outreach Program Coordinator for Washington State University Extension. She provides education and outreach for the Latinx community in a 5-county region in Washington State. So I would like to warmly welcome each and every one of the speakers. We're so excited that you're here. We're so excited that you agreed to share your wisdom, your expertise with us. And I will pass it over to Cherie.
Hello, everyone. I'm really pleased to be here to talk about the work that we are doing with needs assessments. If you can go ahead and advance the slide. I just wanted to start and give you a little bit of a geography lesson, just so you can have a sense of our population that we are serving. So we are one of the implementing agencies in Wisconsin, and we serve 6 tribal nations, primarily in the northern part of the state. These tribes are located in rural areas. The populations range within our 6 agencies, from 300 to about 1,700. So we're not talking about huge population centers here. They're pretty small rural communities. And then, as you can expect, we have issues with access to healthcare, food access issues, as well as transportation options that are rather limited. So I just wanted to give you a little bit of a sense of the population that we are targeting here. Okay, next slide, please. So of course, needs assessments, whenever I hear that, I shiver a little bit, because I always feel like we don't quite fit the mold. And so we struggle a little bit. And so it's nice to know there are other ways of framing a needs assessment. And we certainly have been trying to go down that road for sure. So I just wanted to mention a few of the challenges that we have faced with needs assessments. You may be familiar with these challenges as well. I'm certain they're not unique to our situation, but just wanted to kind of frame it a little bit for you as well. So as you know, oftentimes the American Indian or First American, however you prefer to say it, is not included in the option for race. Some information just doesn't even attempt to look at what the Native American population is doing as far as a survey. So that is certainly one of the challenges we have faced. As I mentioned, our population sizes are relatively small. So, you know, like I mentioned, 300 in one site to 1,700 as our largest. So if you've ever gotten some information back and you get a little asterisk that says sample size too small, and so you don't get any information because your sample is just not enough to be able to draw any conclusions. So we struggle with that a lot when we are searching for data or trying to identify information. Another issue that we come across is oftentimes if there is information that's done statewide in the Native American population, we struggle a little bit with determining how that really impacts some of our communities. If you remember from the map, we do have some tribes that are larger tribes that are more in the urban areas. For example, we have an Oneida Nation, which is located near Green Bay, Wisconsin, which is one of the larger cities in Wisconsin. So obviously, if we look at data taken from a statewide perspective, some of that information that's applying that maybe comes from that sector of the population may not apply to what is happening in our northern, more rural, smaller communities. So we do struggle a little bit with trying to determine how useful that information can be. Another one of our challenges is timeliness. We are very fortunate to work with a epidemiology center here at Great Lakes that works with three states and the tribal populations across those 3 states. And they are able to put out amazing information. However, it depends on their focus at the time. So for example, we had a great information about cardiovascular disease that included information about nutrition and physical activity for our population. But this was something that was done, I believe, back in 2015. So by now, you know, that information is less relevant because it's really been a long time since that information was brought to us. And of course, as our staff is working through the pandemic, a lot of that focus is more on some of those topics versus maybe some of the nutrition information that would be important to us. So we really struggle with finding data that is really timely for us to use. And next slide, please. And then one last issue that I just wanted to mention, and I feel like this could probably be a presentation in itself, but I do feel like it was really important for our efforts to address, and it really makes us think about how we do collect data at the tribal level. So I do want to mention, I did put a few resources on there if you're interested in looking into more about this topic. Like I said, I just want to touch briefly on it. because I feel that it is important. But when we think about needs assessments, they often use similar tools or methods to any other type of research. And so when we look at Indigenous data, which is any information that could impact Indigenous lives, it can include facts, knowledge, information about Native nations or its citizens, lands, resources, or programs. And data sovereignty is actually acknowledging the right of tribal nations to govern their data as they would any other resource. And of course, the sovereignty is important to tribal nations because in the past, they've had to rely on external sources for their information. And this is a result of some of the federal policies of assimilation, relocation, and so forth. Again, that whole issue could be a topic in itself. But we do know that abundant data has been collected on tribes, but it's often not done for the tribes or given to the tribes. And so they really feel like there's been some harm done to Indigenous communities because of research. And it's because of that we encounter some community resistance when we do come to our communities and want to look a little closer and do things like needs assessments. And in this particular situation, even just thinking about our project, when we started talking about it, we got a little bit of kickback from our own educators and our own staff. One of them said, "We're over-surveyed. We're surveyed to death. People survey us all the time." And part of the issue was they felt like promises are made when people come in and want to survey and do things like that. And then there's never any results to that. There's promises made that aren't kept. And so there's really been that resistance within the community around research and things like needs assessments. Can I move to the next slide, please? So it is because of all the information I just mentioned that we were trying to come up with an idea to really get into the communities and hear what they want in a way that is respectful to them. And so we came up with the idea of community conversations. And so I'm just going to go through a little bit about our process, what was our plan, our process, and then some of our outcomes. So we can move to the next slide, please. So our purpose, obviously, we wanted information for ourselves, but we also wanted to build a sense of community around that information. And we really decided that using a talking circle or storytelling format was going to be the way for us to gather information. We really wanted to connect with the tradition that storytelling has in our Native communities, and that was that it was used to share lessons, to speak feelings, and to move a little bit more away from factual type of sessions and things like that. And we wanted to get away from it feeling like it was more of a lecture and more of a professional event and more of a community gathering and a community needs assessment. Next slide, please. So our community conversations program, we decided to focus on two main groups within our communities. The first one being the elders. So elders in the communities are often seen as a source of wisdom and are really, their opinion is respected. So we wanted to assure that we were reaching out to that particular audience. The other group that we are working with is the parents and caregivers of children 6 and under. So we know that there's a lot of information about catching, providing education early, developing those habits early. So we wanted to kind of see where parents were at in our communities. So prior to our events, we developed a project description. So it was a clear explanation of what we were doing, how the data would be used, how we were keeping the data safe, and then what we would give back to the community as far as the data that we collected. So we did actually develop data use agreements with our epidemiology center and with the tribes so that they would have something clearly stated, like this is how we will use that information. We also wanted to make sure that we included the community within this community conversations. So we went out and engaged some community facilitators that assisted us with the events that would go out and recruited some people to participate with us and participated in the actual conversation. And we also wanted to make space for them to help us with the conversation guide that we created. So they had input into what we would ask and how we would ask it. And then we also encouraged them to take a little bit of ownership to it at the time that the events were happening. So we wanted to make sure that they would ask additional follow-up questions, or if there was something happening in the community at that moment that felt like needed to be addressed, they would have that power to go ahead and include that with their efforts as well. And then, of course, incentives. I wanted to mention, of course, that was something we were able to provide. And for the elders, what we actually did was provided a meal. So there are days where some of the meal sites don't provide meals. So we kind of hit on those dates and provided a meal and had the conversation around meals. And so that way, you know, they were getting the extra meal, but we were getting the information and they were able to share their stories as well. Next slide, please. And so as far as our outcomes, so this is still a little bit of a work in progress, of course, but we really wanted to be able to give the data back to the community. So what our researchers did is they were able to identify common themes. And I pulled out an example just to show you kind of what we were seeing. So one example was parents and caregivers are overworked and under-resourced. Now, I'm sure that's not a surprise to anyone, but we were able to take that down a little bit further and see that food insecurity was a source of stress for parents, and that increasing access to affordable foods and healthy foods is really one thing that could help with that stress. So it was themes like that that we were able to pull out and take and look at for ourselves, but also give to the community. I know safety was one that came out in one of our sessions, and that we could you know, do a whole lot with ourselves, but it was something I felt like was really important for the tribes to know, that kids weren't sending or families weren't sending their kids to playgrounds because they didn't feel they were safe areas. And I felt like that was really, really valuable information, but maybe not something we would definitely use. So what we are doing is then we're able to go back with the information we collected and see how we can apply it to our direct education, indirect education, and potential partnerships. One area in particular with the food insecurity is that we have a food security coalition in one of the neighboring counties to one of our tribal lands. And so our educators are able to participate in that coalition to see what's available and be able to share resources back to the community and be part of building up some resources for the tribal communities. So we're really able to make some connections from that, you know, some of the themes that we were given. And we also saw a little bit of a side benefit from my perspective when I was participating in one of the sessions. One of the moms spoke up and said that she felt really guilty about taking time for herself, that she felt like she relied on people so much, but she didn't feel like she should ask for more. And so we actually had another mom speak up and say, you know what, your kid is in my Head Start class, so I would be happy to take them for a couple hours if you need to go do something, get some chores done, and then maybe we can swap sometime. So that actually happened in both sessions that particular day, is that people were jumping in and sharing ways that they could help support the other families within their group. So really was a side benefit that I had not anticipated that we would see, but really brought together the purpose of first of all, our storytelling focus within our needs assessment, but also the community version of the community focus on the Community Conversations Project. And that is the end of what I have. I do have my contact information. I don't know if it's on the next slide, but I'm happy to chat with anyone. If you're interested in hearing more about our information, please feel free to reach out.
Thank you, Cherie. Now we will hear from Beatrice Botello and Stephanie Russell. I'll pass it to y'all.
All right. Thank you very much. Hello, everyone. Today, my colleague Beatrice and I will be introducing you to Health Maps, a tool for mobilizing people to participate participate in assessing health needs and identifying equity issues in the community places where they live, grow, and age. We'll first share a very brief overview of the tool, and then we're going to share highlights from a SnapEd facilitated project that utilized the tool, and that was designed to promote inclusivity of Latinx community members by elevating their voices, experiences, and perspectives. And that project, which was implemented in Lincoln City, a small Oregon coastal town, is still actually underway and in its final phase. Next slide, please. All right, so on the slide, here's a very quick look at the Health Maps tool components, which I'll say in our experience with the Lincoln City project, we found to be quite adaptable, as that project was very much tailored to meet the cultural needs and preferences of the community members we were working with. And I would also say that I think that's something really important to keep in mind when selecting assessment tools. But anyhow, for the sake of time, I'm not going to elaborate any further here, because when we share about the local project, we'll be elaborating a little bit more on some of these components. And we'll also provide you with contacts for anyone with questions about the tool or wanting to learn more. Next slide, please. And speaking of contacts and accessing more info, you can learn more about Health Maps through the SnapEd Toolkit, or by directly contacting the developer and our colleague and OSU professor and extension specialist, Dr. Deborah John. Next slide, please. All right, so we're going to spend the rest of our time highlighting the Lincoln City project. It's really important to note that the reason we did the project in the first place was in direct response to input we'd been receiving from community members, including from several that were participating in one of the remote SnapEd classes that Beatrice and I had been co-teaching at that time. And so it was during that class time where we had kind of just been building these wonderful connections with the families. And then there was a point there where they had shared with us some of their stories and of experiencing barriers related to accessing healthy foods and being physically active. And they also shared that they did not always feel included or know about or know how to navigate the community services and opportunities available to support healthy behaviors. So because we knew that Health Maps was a tool available to us, we kind of did some thinking and ultimately proposed the project to the community members as a way of responding to what they had been sharing with us. And most importantly, to see if it was something they, would want to do and participate in. And they were very enthusiastic about participating in the project. And so we ended up moving forward with it and had 10 community members participate. Next slide, please. So our project was simplified a bit from the tool components you saw on the earlier slide, but included these key phases. The first was to have our 10 community members go out and take photographs in the community that reflected their lived experiences related to healthy eating and active living. We also had them submit descriptions to us along with their photos in order to add details and ensure that we were capturing their experiences and their kind of intentions there properly. And then the second phase was to formally engage with partners and stakeholders, some of which already had some awareness of the project, but this phase was really where we very intentionally and strategically informed and engaged them with the project. And then the third and final phase, which is the one kind of phase still actually underway, and you'll hear more about this, where this is going from Beatrice really soon. But this phase is all about bringing together our community members and stakeholders. And when I say community members, I mean both our photo activity participants who are invited to further engage and identify themselves as, those activity participants and participate kind of to the extent that they wish and feel comfortable, but also to engage, the community engagement is to go beyond our photo activity participants to further engage kind of more broadly the Latinx community. And so we want to do that in ways that are uplifting and celebrate culture and diversity. And this phase will then facilitate further sharing and dialogue with kind of everyone together regarding the project, the findings, and ultimately to help select and prioritize ongoing efforts for change. So next slide, please. All right, so now I'm just going to elaborate a bit more on that first phase, that community photo activity. This was the first of the main project phases, and I have to say it ended up being much more than an assessment, really. And the families shared with us that they really enjoyed the activity. Many of them did it like with their children, with their families, and they thought it was a great way to get outdoors for some fresh air and active family fun. And especially it was kind of happening at the heart of the pandemic, so that kind of just furthered, I think, that for them. But something I particularly like about health maps is this component, because we use photography, but more importantly, the community members as the photographers to capture those just very visual and powerful reflections of their lived experiences. And we all, we experience community all differently, right? And so then we can take those lived experiences documented by their photographs and descriptions that they provided to help communicate their perspectives and help us move forward toward accomplishing policy systems and environmental changes in response. So the photos you see on the slide are just a few that were taken by our community members. The bottom is showing an open space that a community member suggested could be used for a community garden. The top left shows one that a parent had taken of their child going for a walk on one of the roads. And also that roadway safety concerns as barriers to being physically active, whether that be to going for a walk, a run, bike ride, or just walking safely to the beach or a local play area. That was a huge theme that presented through the compilation of photographs that were taken across community members. And then the upper right two photos were from a participant who got a little creative, which we loved. And what she did was take the top photo, which is a picture of her local community play area, and then found the bottom photo online as a way to show what she wished her local play area could look like. So I wish I could share more of those, but that just kind of gives you a glimpse of what happened during that phase. So next slide, please. Right, so for the second and main component was to inform and engage our local stakeholders. And yeah, we were very thoughtful and strategic about the approach we used. And ultimately we invited community partners working in education, recreation, health equity, including areas of nutrition and physical activity, food systems, and access. And we invited representatives from the Oregon Department of Transportation, or ODOT, and we invited representatives from city and county government. We received a great response and ended up hosting 2 stakeholder sessions. They were both done remotely and included a presentation overviewing the project and showing and telling kind of the results from the community photo project. Some great discussions. And one of our main goals really was in doing these stakeholder sessions was to really also get a sense for who really wants to dig into this more with us and the community members, right? Like who's really here for this. And we were really pleased with the response of our community partners and stakeholders. We did have the Lincoln City Mayor attend, as well as the Lincoln County Commissioner, as well as several other stakeholders, including representatives from ODOT, Parks and Recreation, and our local schools there. So there's honestly so much more I could say, but I want to pass along the baton now to Beatrice. And she's going to share with you a little bit about a community garden project that was in part started as kind of an early result from this Health Maps project we were doing. And she'll also share more about the community conversations component that is in the work.
Thank you, Stephanie. Hi, everyone. This has been a great project. And especially during the pandemic where we connect virtually. And as Stephanie said, we built during that time, we built the connection, but also the trust with community members. We connect during the pandemic, a lot of families, they have been using, participants, they have been using cell phones. So we connect by texting and sending like the links for our classes. So that was something that families, they said they were feeling really happy to connect that way, because sometimes they were working or were doing other activities and they were connected and listening and participating. And based on this project, it was an opportunity to apply for a grant. The Danone had a grant. So we decided to apply because the families share with us, or the participants share with us, they really want to focus more in outdoor activities. They were, they share with us that there were not a lot of opportunities for, having outdoor because this area it rains a lot. Sometimes there's no opportunities to be out there when it's raining, or and on some of them they said, well, we would like to see more like some activities with extended family. So we decided to apply for this grant, and this one is focusing on gardening. So we decided to conduct like a survey to see the interest. So we find out that 80% of the families, they shared they want to be connected with a garden in the community. And some of them, they shared they have been driving like 20 to 30 miles to get cultural foods. So that was very important to us to find out that some of the families, they were not able to find food, so herbs they like to eat and with their meals. So we decided to reach out public gardening areas to see, if they can support us with, making this connection. So some of the participants, they shared with us that they didn't know how to establish a connection. So we decided to hire a part-time person to do outreach, and she has been connecting families. And now we have many families interested, and we are looking for opportunities on land, because to find some land available like a public, because the families, they said, well, now I can plant my own herbs, and having that connection, bringing the whole family. So, and the grant also is going to support with the Master Garden. They have this great program that trains for, Master Garden that can give information to plant their own, herbs or fruits or vegetables. But they are working right now, and hopefully we can get volunteers, and encouraged and connected in this area. So we are collaborating to see if we can get volunteers. There's a lot of interest in being engaged with the Master Garden program. Please, the next slide. And so right now we have been we designed two new garden spaces right now. One is for high school. One of this high school, they didn't have a garden. They were looking for a long time. So we found a new place. So they are doing their own gardening, and also with public areas. So we have right now 5 gardens that we are working, and it has been really good. Families, they have been connected, and they are growing their fruits and vegetables there. And the outdoor is happening. So we have been very happy. As I said, we are looking for more opportunities right now to connect more in the community. And one of the parts of this program is the sustainability. So we have been creating like the compost, a lot of the gardens that didn't have the compost, to recycle. So we brought a community partner who has been working with the families and showing how to recycle and how to do their own compost at home. So, and we are hoping that all the gardeners, they have their own compost too. That is going really well. The families, they have been asking a lot of questions how to start their own compost in their own homes, even in their apartments. So please, next slide. And based on these opportunities with the groups, having the community groups, we have the commissioner engaged in these groups, and she called us and say, well, there's funding available. So would you like to apply for this funding? We have some funding, like a 50,000 to continue this collaboration, working the community and the family. So our next is moving to community safety and bringing families and do like a round tables. So the families are able to connect directly with the stakeholders that make decisions. And that's our next option here. Thank you.
And thank you, Beatrice and Stephanie, for sharing that. We really appreciate it. What an exciting project. All right, next we will hear from Mariella Hernandez.
Hey, thanks, Latrice. I'm just going to make a brief introduction to Mariella. So Mariella is the past co-chair, I think, of the Orange County Food Council, which is supported by my SNAP-Ed implementing agency. She's going to share about a broader needs assessment that was done, specifically around how they shifted power. And I just wanted to briefly say how it was related to our SNAP-Ed plan, because their work was much broader than just looking at SNAP-Ed. They were looking specifically at food access in our community, particularly because during the pandemic, there was a lot of food charity going on. And that's all I wanted to share. I'm excited to turn it over to Mariella Hernandez. Thanks, Mariella.
Thank you, Molly. Again, my name is Mariela Hernandez. Good afternoon to all of you. Next slide. So who we are. This assessment was led by a community expert consultant, and her background was lived experience within the community and deep relationships, and designed the project scope and goals for this assessment, recruited other community members, community experts in the community, and advised the research, the coordination, and the final report. Our research and coordination team worked with a lead community expert to implement the steps as the assessment went on, materials we gave to the community, and to support like the background. Community experts, we got lived experience, which people who were experiencing the need of food and the access to food, developed recommendations for policymaking, participated in a 2-month photo voice process. Next page. Purpose, our purpose is shifting power and listening to experts. The equity is about power shifting and resource sharing. We started off asking ourselves in our community, who gets to make decisions for who and how? Why have others assessments have not worked, or surveys not developed more effective to the solution of food access? And why haven't they created trust? Previous surveys, obviously, or experts. Do those experiencing food insecurity feel like these charities are working? So by respecting live experience as a subject matter expertise that should be compensated and listened to. So when we get this community experts, one of the biggest thing is that we didn't want to tokenize them, give them a few gift cards for the participation. To us was a slap in the face, you kind of wanted to say. So one of the biggest things is we were trying to get cost of living of the amount of time, pay them the cost of living for them to share the expertise, because they are experts in their community. Next slide. So step by step, we asked community leaders if they could participate in the food access assessment for community commissioner report. We shift answers was, why do you need to get assessed versus listening to us? The community experts, they asked for an audit from the county, and they wanted to be provided transparency of where the money went to give to charities, and how this money was spent. We recruited 12 community experts representing a wide spectrum of the community most impacted by food insecurity. This is Orange County, has 3 municipalities. So our biggest target was to get community experts from these 3 counties, variation of immigrant, refugee, and the Black community. We did two assessments. One was a 2-month photo voice with a smaller group, and then a 4-session of data analysis and recommendations developed with a larger group. Next step. Final report. This was not a traditional assessment. It was a process of working with the experts to analyze what has been done and develop recommendation and what could it be. If we started to operationalize value like equity and justice. Final report outlines to the process. We share key resources that inform how we did this work and lay out specific recommendations in the words of our community. We incorporated poetry, art to add a creative element, root the report in the lived experience of food insecurities. Next. Here's one of our poems from one of our community experts. This was related to food. The lady did several relating to what the experts, but I'm gonna read one of them. The blazing sun cooks the skin during this summer heat. People linger around with the impatient bellies. They growl to be satisfied. Anticipation for those simple package of food grow thick in the air. Rations of food are their saving grace during a time of turmoil. The packages are given out one by one. Hen hustling open the package once home. They are filled with bruised fruits and vegetables. The only salvageable thing are canned food or meat. It's a struggle to keep them preserved in the summer unforgiving heat. Some have no proper storage to blissful cold air. Money flies when you're trying to keep food from leaving the table. The howling stomach cannot be kept at bay for long. And a lot of these words that this lady put in her poem are conversations that the experts had about how they have experienced food distributions in their communities. Next slide. So recommendations, we have one example. We need more effective design and direct way of providing food assistance. One of the ideas is a service similar to Instacart should be able to the public, a public program. People should be able to choose their food and schedule picked up or receive them. They would keep increased access and dignity for those who receive food assistance programs, especially for those who are homebound or need delivery service due to transportation issues. This service would accept EBT, SNAP, and other funds, and they are participating are able to apply. Next. Second recommendation is there is a need to focus on longer term change, not just in immediate needs-based services. We need deeper investment in ending hunger that addresses the underlying usage like wage and cost of living. Housing is one of the most important thing housing is an important part of those long-term solutions. Recommended that any new developer coming to our city would propose and build new apartments, that they should be allocated a few to subsidize and affordable living. And that was it for me. Thank you.
Thank you, Mariela. Now we will hear from Mariah Brown Pounds. I'll turn it over to you.
Hello, everyone. My name is Mariah Brown-Pounds, and I am the SNAP-Ed Latinx Outreach Program Coordinator for Washington State University Extension. Today, I'm going to talk to you about a physical activity needs assessment I performed in Bellingham, Washington. Next slide, please. So here's some background as to why it was important to do a physical activity needs assessment. According to the CDC, 20 to 25% of the Latinx community in Washington State self-reported to being physically inactive, compared to 15 to 20% of the non-Latinx white adults. And 35% or more of the Washington State Latinx community self-reported to being obese, compared to 25 to 30% of non-Latinx white adults. Also, according to Salud America, in Whatcom County, 28.5% of Latinx children live in poverty, compared to 9.6% of their non-Latinx white counterparts. According to the Washington State Recreation and Conservation Office, trail use improves health, resulting in over $390 million in health savings for Washingtonians annually. It also contributes more than $8.2 billion to Washington's economy and provides over 81,000 jobs each year. So there is a real need for increased physical activity opportunities among the Latinx community in Whatcom County. This would improve both health and economic outcomes for the community. Next slide, please. So the purpose of this needs assessment was to determine what the community needs are around improving the environment to make physical activity more accessible for Latinx communities, individuals, and families. Before jumping into any projects, I wanted to get a deeper understanding of the needs and wants of the community. Next slide, please. So I decided to reach out to Sterling Meadows Apartments, which is subsidized farm worker housing in Bellingham, Washington. The residents are primarily Latinx. Oh, can you click again twice? I think it's, thank you. So I worked with them before the pandemic doing cooking classes, and they had expressed interest in doing a walkability assessment at that time. In the fall of 2021, I asked the resident services coordinator if he thought the residents would be interested in doing a walkability assessment, and he said that they definitely would. So we set dates for a walkability audit and a follow-up focus group. On the day of the walkability audit, I also did an informal door-to-door survey. Next slide, please. So for the door-to-door survey, I knocked on the door of each apartment to describe the purpose of the walkability audit and to invite families to join. Most of the residents were home and came out to talk. Not all of them were able to join in the audit, but everyone had something to say about the walkability of their neighborhood. The consensus was that it felt stressful and unsafe to walk in the area. Some things that people mentioned were that people drove too fast on the road, drivers didn't pay attention, and there was low visibility for drivers because of the cars parked on the side of the curvy road. Many also mentioned a camper trailer that had aggressive dogs and people living there that made them feel uncomfortable walking past. Next slide, please. We performed the walkability audit in September of 2021. We used the walkability checklist tool pictured here, and there is a link to it in the slides. I gave everyone reflective vests and clipboards and gave them a brief introduction of what we were doing and why it was important. We walked together as a group to the end of Sterling Drive, which is the road that runs past Sterling Meadows. As we walked, we talked about what we were seeing and what we would like to see and took notes. So the next slide, please. So here are the results from the audit. These are some pictures that I took as we walked. You can see that it isn't very pedestrian friendly. We gave Sterling Drive the lowest possible score on the walkability index. There were no sidewalks and there were cars parked along the side of the road that forced pedestrians to walk in the middle of the street. There was no street lighting, there was no shoulder or bike lanes, and the noise from the adjacent freeway made the walk stressful and unpleasant. It was also brought up on the walk that it would be nice if the 2 vacant lots along the road could be turned into parks. The residents were enthusiastic about the idea of having a nearby place to go and enjoy being outside with their families. Next slide, please. So as a follow-up to the walkability audit, we did a focus group at Sterling Meadows in October of 2021. I worked on the questions ahead of time with our SNAP-Ed evaluation team. We had 11 people attend, and the conversation was lively and enthusiastic. The meeting bounced back and forth between English and Spanish, and a rich conversation about the barriers and solutions to physical activity ensued. Next slide, please. So here are the results from the focus group. Some barriers that people mentioned included feeling unsafe in their neighborhood because of the lack of sidewalks and streetlights and the fast cars. People also mentioned weather, time, and motivation as being barriers to physical activity. Ideas for improving physical activity included offering music and dancing opportunities. This suggestion received an enthusiastic response from everyone in the room. Also, family-friendly activities, morning and evening walking groups to fit different people's work schedules, free exercise videos, exercise equipment at bus stops and parks, and more accessible gyms. So there were a lot of great ideas that came out of the discussion. Next slide. So I shared the results of the walkability audit and the focus group with Chris Como, the Bellingham transportation planner. After some persistent encouragement, he got back to me and even drove to the neighborhood to take a look. At the time, he was not encouraging about the prospect of improving the street. He said it would cost at least $1 million to put sidewalks in and didn't expect to be a priority since it was a dead-end street. Next slide. So however, while I was out on maternity leave in 2022, the city of Bellingham began their 2022 pedestrian and bicycle master plan. Chris Como hand-delivered surveys in English and Spanish to Sterling Meadows apartments. Unfortunately, the resident services manager went out on unexpected leave and never passed out the surveys. In a conversation with Chris, he let me know that he has only received 5 Spanish surveys back about the master plan from the whole city. Chris also did an interview about Sterling Meadows with the housing and education manager at Mercy Housing. She mentioned many of the same concerns that I had reported to him from the residents' feedback. Lastly, city staff were able to attend the Sterling Meadows Back to School Fair this August. So there has been some synergy between the city and Sterling Meadows lately. Next slide. So moving forward, I plan on coordinating with the city and Sterling Meadows to make sure that the Spanish surveys do get filled out and returned to the city. I may also partner with the city in reaching out to other subsidized farm worker housing to help get everyone's feedback about the walkability and bikeability in their neighborhoods. I also want to follow up on the results from the needs assessment. This is a map of the Sterling Meadows area. Sterling Meadows Apartments is in the middle. On the bottom right are the 2 vacant lots that the residents wanted to turn into a park. These lots are owned by the Bellis Fair Mall. There's also a vacant lot right beside Sterling Meadows in the upper left-hand corner of this map that is owned by a community church that has already offered up a space for Sterling Meadows residents to have a community garden. So I'd like to contact the church and possibly Bellis Fair Mall about what it would look like to turn these lots into green spaces or parks. This would be a fun opportunity to dive deep with the residents about what they would like to see with this space if it were offered. A potential partner in this would be Bellingham Parks and Recreation. I am also interested in doing a photo mapping project with the Sterling Meadows residents to further explore their perspectives on physical activity in their neighborhood. Lastly, using the feedback from the focus group, I would like to get some walking groups going and see if a resident wants to continue them on. And I can organize dance classes or offer free exercise videos. Next slide. So thank you so much. This is my contact information. Feel free to reach out if you have any questions. Thank you.
Thank you, Maria. We really appreciate you and all of our presenters for sharing their projects, their ideas, their process with us. We really appreciate it. So there are a couple of broad recommendations of practices that you can incorporate as you embark on an assessment in your state. And these are just a couple, but again, there's a lot of information that we can glean from our presenters today. And some really, many of these practices include just being really intentional And that includes being intentional about who the priority audience is. So really recruiting a variety of organizations, partners, organizers at the onset. So not at the end, but at the onset in the planning, prioritizing organizations that tailor their services to people who are racially and ethnically in marginalized groups, people who speak another language, people from different geographic areas across the state, really creating a plan to center voices from community members. It's really important to not only be able to kind of gather this information, but really creating processes, institutional processes that really respond to them. So we don't want to just kind of gather information. We want to be able to be in a position to respond to those. Think about how questions are asked. Think about creating inclusive spaces. So if you're holding a focus group, a listening session, visioning session, town halls, that we're really being intentional about creating spaces that accommodate people who live with a disability, accommodate people who may not work between the hours of 9 and 5, accommodate people who aren't able to attend in person. So making sure there are virtual and online options and dial-in options for folks. A lot of this work, like I said, is really being intentional about centering the voices for marginalized people. Consider the timing, consider the location, consider, interpreters. Again, thinking about your geographic areas. I think, if you host a listening session at Monday at 10 a.m. only in English, you've essentially made a choice about what audience you want to hear from. And so you might not have written that down, but that is a decision that you've made. And so really being intentional about creating spaces where you're going to get a variety of thoughts and ideas, and being intentional about that from the onset. Really investing in ongoing discussions. So not just kind of showing up and collecting information and leaving, but really creating relationships that are less transactional. And again, thinking about internal processes is really important to think about, okay, how do we as an organization respond to feedback? What can we do to support some of the ideas that community members have put forth? Next slide, please. So for the state agency, just a couple of my initial thoughts, and they are by no means all of the ideas, but really thinking about, timing, funding, trying to be as broad as possible. There's a lot of ways to do this, and you don't want to limit. Making sure that, of course, your program aligns with SNAP Ed guidance and with state regulations. But other than those, really creating an expansive framework so that agencies can really be flexible in how they work with community members to do this work. And really thinking about, during the planning phase, what's the overall structure? And how exactly are we going to be good stewards, not only of funds, but of the time that people are going to be giving to our programs. Next slide, please. And now we have reflections. So, what's resonating you? What's challenging you? What practices should we, keep in mind as we are doing this work? And if you'd like to share in the chat, we welcome that. But we wanted to take some time out of our webinar to kind of think through what are some things that you've heard throughout this presentation that you think you could use, that you think you could replicate in your programs, and where might there be some pain points, what might be a struggle. So if you'd like, like I said, if you'd like to share in the chat, feel free. Or if you'd just like to kind of think that through with your team. We welcome that as well.
Thanks,
And-
Patrice. Yeah, we have a couple of minutes, y'all. So we'd be very curious sort of what was resonating with you. Some of you did put that in the chat, but curious, or also sort of what questions you have, because we are doing a discussion next week. So curious to see what you would want to discuss more of in those breakout sessions. So thanks for those of you who are putting some things in the chat. Continue to do that if you have things. We would love to take a look at them. We did get questions in the Q&A and we answered them in real time in there. We will send out those answers. Very good questions we received. So you will see them and they'll be posted in the same place with the slides and the recording. We can go to the next slide. Well, we can go to the next slide. There's two slides of resources, y'all. So free to peruse those at your leisure. You will have the links there to take a look. Open the last slide. We encourage you to attend the community of practice discussion that we will have this time next week. I put the link to register in the chat. It's also here on the slide. We will be breaking folks up into groups based on if you've done a needs assessment before or not. So be prepared to self-select into a group. But yes, that's what we'll be doing. So we look forward to seeing you all next week. This link to the registration looks like it's not working for some people. It was sent out with the original email and we'll make sure folks receive it if you can't get it now. But you got the email with these slides and that also has this link in it if you need to go back to that. Yeah, well, we actually are slightly ahead of time. Yeah, so I just continue to put things in the chat and we'll read them. But I just wanted to thank all of our speakers. I learned a lot. I was madly taking notes while also trying to keep up with the chat. So thank you all. And thank you to our hosts and also all of you for attending. We really appreciate having this chance to learn from each other. So thank you. Hope to see you all next Thursday. Have a good evening.